staff and student absentee rates, ability to implement the mitigation strategies, and ability to maintain appropriate staffing for the essential functions of the school. We ask that our students, teachers, and staff continue to follow the COVID-19 health and safety guidelines and protocol to help reduce the spread of the virus. We ask that everyone continue to wear your masks, wash your hands, and socially distance. We are encouraging those who are eligible to get the vaccine to become vaccinated to help keep you and your family healthy and safe. DeKalb County School District's partner, the DeKalb Board of Health, is offering free COVID-19 vaccines at its mobile clinics. The vaccine is free and there is no need for an appointment. ID, proof of citizenship, or health insurance is needed to get a vaccine at the mobile clinic. In partnership with the DeKalb Board of Health, DeKalb County School District is also offering vaccination and testing for staff, families, and students at the Administrative Office Complex, or the AIC, tomorrow, September 3rd, 2021, between the hours of 8 a.m. and 1 p.m. Please continue to see our district website to receive up-to-date information on all vaccination and testing opportunities. I'm joined today with members of our leadership team. As a reminder, all of our decisions are made collectively with our COVID-19 task force that is led by our Ms. Stacy Stepney, who's here with us. I'm also joined by our Deputy Superintendent, Deborah Moore-Sanders, our Interim Chief Operating Officer, Mr. Boyd, and our Region 7 Regional Superintendent, who provides direct oversight for the Oakview Elementary School. At this time, we thank you for your attendance, and we will open this up for questions. Thank you very much for the question. We monitor all of our schools every day. We work again with the DeKalb Board of Health to assess any positive cases, to assess who has been in close contact. That is our daily activity. If your question is more about are there other schools that are in a similar situation of Oakview and how we determine whether a school will close, a classroom will close, or a school will close, I'm going to ask Ms. Stepney if she would come up and speak a little bit more to our decision-making process. Ms. Stepney. Thank you.
Good afternoon. Thank you so much for that question. Our DeKalb County School District procedures, again, as our superintendent stated, we monitor several aspects before we make a decision. It is in partnership with the leadership at the local school, so we can determine what the operational risk is at that local school. So that's where it begins, a partnership with the leadership, the principal, and the regional superintendent. Our team at central office monitors the data. We're doing that by the hour throughout the day. As we monitor the data, it's really important for us to ascertain whether or not the school has what is needed to be what we deem operationally fully able to function. And once we look at everything, meaning no single metric, we look at everything, are they able to continue having school where we have available staff, the appropriate staffing to perform all essential functions. And so we are monitoring schools, to answer your question, daily.
But there are no other schools in this situation, this acute situation, as the one that we've decided to close because we feel that this is the best decision for this school community at this time. Thank you. Yes. To speak to the updating of our COVID-positive COVID-19 cases, I'm going to ask Dr. Moore-Sanders to join us. Thank you.
Thank you for that question. We monitor our data on a weekly basis. And what we do is we update from a Thursday to Thursday so that we can post on a Friday the number of cases that are there. So we count through what took place last week from Thursday to this Thursday, and then we update our data at that time. I will share with you that we did decide to post our data differently rather than providing cumulative data. We thought it was more beneficial for the school community to provide real-time data so that everyone would be aware of what is occurring within their community.
Thank you. And my team's doing a wonderful job. I just listened very closely. I just wanted to just maybe make one correction. The cases are monitored daily. Daily, we monitor the cases, and those are shared. If we have a positive case, those are shared with the school community and our Board of Education on a daily basis. The information that's posted on our website is a week-to-week report, as Dr. Moore Sanders shared. Thank you.
Part of your opening statement, but is the school open today, and was there any reason why you decided to wait one day instead of closing today?
Thank you. I so appreciate that question. The school is open today. All of the students that have been impacted that we spoke about, the 18 students that tested positive, the 90 students that were identified in close contact, and the 13 staff members have all been identified in our quarantine as of today. They're not at the school building right now. The reason why we've decided to close the school is because the number of impacted staff members and our confidence in the school's ability to maintain the high quality and effective operations of the school during this time that we have 90 students who were in close contact, as well as 13 staff members that will be quarantined. So we are confident that we've isolated the situation right now, and those the impacted students and personnel have already been identified in our quarantine. But we want to make sure that we're not putting any undue burden on the school staff to operate the school effectively over the next few days.
Would it have not been feasible to postpone classes today instead of a turnaround, perhaps to try to alert parents and make that work? I'm just wondering, maybe we may speak to parents later, like, well, why weren't they closed today?
Yes. Our decision-making process was to make sure that the students and the staff have everything they need to pivot to the virtual instruction. That was the decision that we made. We thought that was in the best interest of the school, as well as making sure that we were keeping our students and our staff safe. Thank you. I'm sorry, the noise. Tracing? Oh. Okay, good. I'm going to invite Dr. Moore Sanders back up to speak to what we're doing around testing and also the access to our vaccines. Thank you.
Hello again. In reference to your question around contact tracing, what we do in our buildings is to determine what individuals may have been in close contact with a person that has tested positive. Our district does not do the full contact tracing. That is done through the Department of Public Health, because they have a different protocol for ensuring that everyone who has come in close contact are notified and are provided actual guidance for what it is that they need to do. To share with you regarding what Superintendent Watson Harris mentioned around our efforts for vaccines, we have partnered very strongly with the Department of Public Health, the DeKalb County Board of Health, to offer vaccination events for our families. We will be hosting vaccines within each one of our regions. That process will start on the 13th. So any family who has not become vaccinated or a family who has not updated their immunization records, they would have an opportunity to access those services within our district. In reference to our testing efforts, As Ms. Watson Harris has shared, we will have an event that will take place tomorrow that will allow staff, students, and families, if they need to, they can get a test and they can also become vaccinated. We will have opportunities available for Oakview community to ensure that those individuals feel confident when they report back to school. We are also setting up another site so that our families can feel confident that there are locations that they can come and get testing if needed. Thank you. Yes, I can speak to that. One of the things I want to share is that the testing aspect for all of Georgia has been taken over by the Department of Public Health. So we are working in collaboration with the Department of Public Health to secure the application to provide surveillance testing for our school district. That application process is being completed, and once completed, all of our schools will have access to the surveillance testing that is offered through the Department of Public Health. Right now, we are in communication with the Department of Public Health to answer those questions and to ensure that the application process is thorough and complete.
One or two more questions. Staff members are having to quarantine and isolate. Is that going to be tested positive, or they are vaccinated and bring contact? Give us a more perspective on that. 13, yes.
What we know regarding the staff members at Oakview is that they were in close contact. And so our protocol that we do for individuals that have been identified as close contact, they quarantine for a period of time to ensure that they do not develop symptoms. And if they do, they will consult with their healthcare providers. So at this time, those staff members are under quarantine because they were in close contact.
Last question. What's the vaccination rate for the DeKalb County School administrators and teachers? Because this level, the elementary school level, most of the students cannot get vaccinated.
The level of vaccination.
What I can share with you is that the vaccination status of individuals is definitely covered under HIPAA. And so what we have done is sought from our employees to tell us voluntarily how many individuals are vaccinated. So from our survey, we probably got a good 5,000 individuals who responded back to us. That survey is still open. And at this state, 89% of those individuals reported that they are vaccinated.
Yeah. Thank you so much, Dr. Moore Sanders. I will say also many of our principals have administered anonymous surveys to just have a better idea of the percentage of staff members that are vaccinated. Our goal at this point is really to encourage our staff to make sure that they have the information to make informed decisions about how important it is to be vaccinated, and to provide access via the mobile units with the DeKalb Board of Health or the events that we will be hosting here at the AIC. Again, we thank you for being here. Thank you for helping us get our message out. And if I could just conclude with any top of mind thoughts, it's that we are monitoring the safety of our students and our staff and any positive COVID-19 cases every day. We're doing that. We have a dedicated staff that's looking at those cases specifically, working very closely with our DeKalb Board of Health, making sure that our school leaders have all of the supports and services that they need to continue to keep everyone safe, as well as to continue to improve communication so parents are not wondering about where we are in our safety protocols. And so I encourage everyone to continue to go to our website as we receive feedback, such as the way we post data, we make improvements. So we're all in this together. We're going to keep our children safe. We're doing a great job with the mitigation strategies across our district, and we're going to continue to work with our elementary school to make sure that all of our students and our staff are safe. So we thank you very much, and we hope you have a pleasant day and that you stay safe. Thank you.
Any additional questions can go to Carla, CARLA_Parker, PARKER, at DeKalbSchoolsGA.org. Thank you.